Hello, our team has conducted this semester Capstone project under the guidance of Professor Jang, focusing on the topic of development of decision supporting system for managing patients with liver disease. I will now begin the presentation on our research. In Korea, liver cancer is the second most common cause of cancer death, with a significant 72.3% of disease cases associated with the hepatitis B infection. This highlights its critically the ability to predict liver cancer development in patients with hepatitis B. Equally important is the need to address treatment strategies for hepatitis B, which include predicting potential side effects from medicines. To meet these needs, our project has focused on creating a predict model. This model is intended to predict the likelihood of hepatitis B patients developing liver cancer within the next 5 years and to identify possible side effects during their treatment. The goal is to provide physicians with a robust tool for better patient management and to enhance the overall treatment protocol for hepatitis B. Our initial project is centered on the development of predictive model for liver cancer in hepatitis B patients, targeting a 5 years forecast period. We are in the process of gathering comprehensive clinical data on hepatitis B patients and will be employing machine learning algorithms to estimate their risk of developing liver cancer within this time frame. The design of our model aims to achieve better predictive performance, especially when working with limited data set. Also, it's striving for a better improvement in prediction rates over the existing model. Through this enhanced predictive capability, we expect our model will better aid in the improvement of both the prevention and intervention strategies for liver cancer in hepatitis B patients.
Then I will talk about prior studies about problem 1. There were some school models called MPHB, RICH-B, GAG-HCC, which are used to predict hepatocellular criteria, accuracy number. This table shows the score calculation criteria each model has. Those school models make scores by using inspection results like gender, age, platelet, and so on. Those school models predict the probability of developing hepatocellular carcinoma based on the scores from those calculation criteria. Going further from those prior studies, our goal is forming machine learning models that can predict better than the school models I discussed in the previous slide. To achieve this goal, we are going to use several machine learning algorithms like random forest, XGBoosting, light gradient boosting, Belford mirror network. By using given medical data from our university, we will approach this problem by using these algorithms to generate a model that better predicts hepatocellular carcinoma.
The second topic of our Capstone project is drug side effects prediction. First, the problem statement is predicting long-term side effects of hepatitis B treatment drugs. Insights from the model aid in proactive health management and potential mitigation of adverse drug reactions. Second, the constraint is the model should accurately identify the probability of 3 adverse drug reactions simultaneously in real-life clinical context. Third, the objective is predicting the occurrence of side effects after 3 years of hepatitis B treatment drugs through function is forecast the probability of developing specific side effects such as renal failure, hypophosphatemia, and osteoporosis due to long-term medication use. Before processing this study, we looked into models conducted by the previous Capstone team. This is the result of predicting the occurrence of adverse drug reaction 3 years after taking the drug. We found that the effect and model predicts renal failure and hypophosphatemia better than the random forest model. And osteoporosis performs better than predicted by the random forest model. Next, we'll explain the approach of our new research.
I'll move on to the research approach. As we mentioned before, our task is to develop a model to predict future side effects by utilizing multi-level classification. And as we assume there is a mutual relation among side effects caused by hepatitis treatment drugs, we aim to enhance our prediction performance by applying it to our model. We use the classifier chain method to implement the relationship that leads from renal failure to bone disease, which could be defined as a conditional probability equation. At the data pre-processing stage, we extracted and organized the data from the database following the way of previous study. And in order to obtain sufficient data, we assumed that patients without the exam results have no record because they had no issues. So we classified them as normal and made use of such data. In case of model, we have decided to use the random forest, which has shown the most consistent and comparatively better performance at the current stage. For model evaluation, we basically use RC, accuracy, and FO score to briefly check the prediction performance of each side effects, and the final evaluation criteria are the exact match rate and the Jacquard score. We checked the simultaneous prediction performance with EMR and evaluated the correlation among the side effects with the Jacquard score. So the overall objective of the study is to improve the prediction performance of side effects, and we plan to continue researching other improvement methods for the purpose in the future. That's the end of the presentation. Thank you for listening and hope you find it interesting. Thank you so much.